Hey, 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 and it's a beautiful day. Children, mommies and daddies, good morning. Rise and shine. You're tuned in to 102 FM, the number one fun station in the UAE. And we're broadcasting live at Al Jalila Culture Center for children at Sukaim 3. Today is Thursday, October 10th, 2019. Let's not forget that it's the year of tolerance and it's the weekend hangouts. Yes, if you have any plans for the weekend, let me know on the WhatsApp number on 056-995-0022. That's 056-995-0022. Or you can call me on 600-551477. The reason why I just gave out the number is because I've got an incredible, amazing, handsome doctor here. Amazing guest, Dr. Mina Charopeme. He is a pediatric, oh my God. He is a pediatric, there you go, pediatric dentist, and today we're going to be focusing on the importance of oral health in children and how it is related to overall health. Good morning, doctor.
Good morning, Saif. How are you?
I'm doing great. How do you mention pediatric? Did I say that correctly?
Yes, you said it correctly.
I thought that was hard for me.
No, it's pediatric dentist.
There you go, pediatric dentist. Okay, so doctor, what are we focusing on today?
We're talking about how to keep our teeth clean, how to prevent cavities, and why it's important for our general health.
Amazing, amazing. Okay, so let's start off with the first question. What is a pediatric dentist and how a pediatric dentist is different from a general dentist?
Well, a pediatric dentist is a special dentist that he only treats kids. He doesn't treat adults. He specializes in treating kids. 90% of our job is physiological, psychological rather than the dental work. Because as we all know, some kids are really hard to be treated with the dentist, especially if they're so scared. Like even our words are so different. We use, for example, Mr. Thirsty who drinks the water. You know the suction that sucks the water inside your mouth?
Yes.
We don't call it suction, we call it Mr. Thirsty.
Mr. Thirsty.
Yes.
He just loves to drink that water out of you.
Exactly.
All right, cool. So, doctor, there's this most important thing is that about our kids, especially when it comes to cavities. And I want to know, Dr. Mina, can you tell us why children get cavities?
Before that, the parents and kids need to know that the cavities is an infectious disease. It's more common than asthma and diabetes type 1.
Oh.
Yeah. That people don't believe that, but it's a true fact with research based.
So this is something not to mess around with.
No, people need to take it really serious.
All right, so Dr. Mina, can cavities be prevented and how can it be prevented?
Yes, it can. The good news, it can be prevented, especially that I'm a strong believer that's in the saying that says prevention is better than cure. Mm-hmm. We can prevent cavities by encouraging strong oral hygiene measures and promote healthy eating. Okay,
so Dr. Mina, what are the strong oral hygiene measures that needed to be done for children to prevent cavities?
There are many steps that need to be done to prevent cavities. Mm-hmm. The rule is that children below the age of 9, parents have to brush for them. They are not allowed to brush by themselves.
Okay.
And then there's the 2x2 rule, that is brushing 2 times per day for 2 minutes, once after breakfast and once before they sleep. Flossing is really important for kids. And if your child is above 6 years old, you have to introduce anti-caries mouthwash and tongue scrubbing.
All right, but doctor, if you don't mind me asking, out of the interview, why is flossing really that important?
Because your toothbrush does not enter between your teeth, and food gets stuck between your teeth, and inside our mouth there is bacteria. So the bacteria eats the food in between your teeth, causing the cavities.
Oh, okay.
And we see a lot of kids, I have a lot of patients coming. Most of their cavities are between their teeth.
All right, so mommies and daddies, feel free to call us on 600-551477. You can ask Dr. Mina. He's a pediatric dentist. He can answer all of your questions. And I'll be right back with you, Dr. Mina, to talk about more stuff regarding the importance of cavities and stuff like that, how to prevent it, and much, much more. Stay tuned, mommies and daddies.
Send your morning wishes and keep us updated with your picture or video.
Hello, mashallah. You are definitely the greatest. Back to topic of the day. We've got Dr. Mina Charopeme, the pediatric dentist, and we're talking about the importance of oral health in children and how it is related to overall health in general. Good morning, doctor.
Good morning, Saif.
How's everything going on?
Good.
We were just having this random funny conversation off air about, children and how much we love children because we appreciate their honesty.
Yeah.
And you just said something really important, Daddy, that triggered my brain right now. That you said that I love working with children.
Yes, I do.
So why? Why is that?
First of all, because they are honest about their feelings. If they don't like you, they just say, "I don't like you," and if they love you, you are their hero.
Yes, and as you know, doctor, you've been sitting here like for almost like an hour now, and I'm sorry for keeping you late. But you can see the videos, you can see the messages that I'm getting, and it's just that the kids, I really love them so much, and the way how they express their feelings, it means a lot to me. And one of the reasons why I have Dr. Mina Charopeme here today on the show, because he is a professional. Yes, he is a professional dentist, and he works with kids. He loves working with kids. And today's topic is something really, really important. We're talking about cavities in general. So, doctor, how can we encourage or promote healthy eating for children, and how to decrease their sugar, sweets intake as well?
I meet a lot of parents complaining that their child is not eating healthy food, and the kids would prefer chips, chocolates, and sweets. Okay, who doesn't like sweets? Come on, we all like sweets.
Of course.
Okay, so here is the deal. Here's how the parents should handle the kids. It's a simple rule: no lunch, no sweets. No lunch, no sweets.
Oh, okay.
So that's
it's like a win-win process.
Yes, and it's like a treat, and kids like treats, like they like to be awarded. So we always say no lunch, no sweets, and even I advise, if the parents agree, that the kids can have sweets every day if you want, but in a couple of conditions. Number one, it's once per day. Second, it should be after lunch and maximum 5 o'clock. And also we encourage not to give more than one type of sweets.
Okay, that's really good. I just received a message here from Jasmine's mom. She says that's what she does. She's answering your question as well. The question that I asked, and you said about not if you don't have lunch, you're not gonna have sweets.
That's perfect.
So she's replying right now. Jasmine's mom. She says that's what I do as well.
That's perfect. Another advice we do: please try to reduce the candies and anything sticky.
Anything sticky,
like gummies, caramels. Try to avoid it. Also, try to reduce their intake of sugar, especially from juices, canned juices, flavored milk. That's a lot of sugars.
Okay.
You can encourage ice cream and frozen yogurt. That's really healthy option.
All right, I just got this important question here from George. He's a daddy, sorry. George is saying that is it okay to give sweets before sleep?
Not at all.
Not at all, George. There you go. You're talking to Dr. Mina Charopeme. He's a professional here.
We always say maximum 5 o'clock. After 5, please, no sweets.
All right, after 5 o'clock, no sweets at all. So, doctor, I have a personal question. I got two incredible kids, and one of them, he loves chocolate. Hamdan. My son Hamdan, God bless you, Hamdan. I love you so much. I know that you're not listening, but anyways, he loves chocolate. But I want to know, is it okay if I give him like at least one piece of chocolate throughout the whole day?
Yes, and my advice also, we do encourage if you can start giving dark chocolate because because it's more healthy.
More healthier.
Yeah.
Okay, that's a very good one. All right, and Jasmine's mom says Jasmine is happy about that rule. That if you don't have lunch, you're not going to have your sweets thingy. And she says sweets make them hyper. Is this right?
Yes, and that's another reason we say not after 5. Because if you give them sweets at night, answering George's question, she won't sleep and he will be having a hard time.
All right, so Dr. Mina, can you tell us what are the preventive measures that can be done to avoid cavities?
The first thing that both children and adults should visit their dentist every 6 months. They have to do their regular cleaning, fluoride application, x-rays if needed, and sometimes we put something called fissure sealant to prevent development of cavities.
All right, cool. And when should parents take their children to the dentist? At what age, most specifically?
According to the American Academy of Pediatric Dentistry, the child should visit the dentist at his first birthday.
All right, cool. And parents usually complain that their child does not want to brush their teeth. And what do you recommend, doctor?
It should start from birth. Parents should develop a routine for the baby from their birth to clean their teeth. I always tell the parents, especially mothers, of course, that even if she's breastfeeding or bottle feeding, even if there is no teeth, to brush their teeth using a silicone brush, just to massage the gums.
All right, cool.
Yeah, and we also and they should encourage them to brush once after breakfast and once again before they sleep. And also, the parents should brush in front. They should brush their own teeth in front of their kids.
Yes, because there's this famous quote that says a kid would follow your example,
Exactly.
but he won't follow what you say.
Exactly. And also, sometimes we do advise something funny, that kids sometimes will not accept to brush for them. So what we do advise, parents brush for each other. So mommy brushes for papa and papa brushes for mommy. So kids will accept the idea that someone will brush for them. And use the word help. Kids will accept the word help, not to do.
That's cool. That's cool. And I know that you answered this previously, but what kind of toothpaste should be used for children in general? And what is the correct amount of toothpaste to be used?
Okay, so here is the deal. Each age has a specific toothpaste. Okay, and the guideline is the fluoride toothpaste. I get a lot of parents saying we don't use fluoride. I'm sorry, that's wrong. Because they say I don't know from unknown resources that fluoride is bad for your health. No, it's wrong. It has been used for over 40 years, as long as you use it in the right quantities. So according to the European Academy, the right amount of fluoride, you should check it on the back of your toothpaste. So if your child is from 0 months till 2 years, it should be a 500 ppm fluoride, and this amount should be a rice piece. If the child is 2 to 6, it should be 1,000 ppm fluoride, and that's a pea size. 6 and above, it should be 1,450 ppm, again, a pea size toothpaste.
All right, so Jasmine's mom here, she says that non-fluoride is the best. Sorry, I would disagree with Dr. Mina. And she says under the age of 6.
No, again, she can check the American Academy, Pediatric Dentistry. She can check the European Academy. And if she wants, on my Instagram, I have a screenshot of the European Academy says the fluoride. Fluoride, even in other countries, they put fluoride in their tap water to prevent cavities. Fluoride is safe as long as you use it with the right quantities.
Thank you very much, Doctor. And Doctor, a lot of kids are afraid from the dentist, and even sometimes adults. I'm afraid of dentists.
Me myself, I don't like to go to the dentist.
So Dr. Mina, what should be done to avoid fear from the dentist?
Okay, the first thing they need to do, kids are very smart and very sensitive. So the first thing that parents should do, the parents themselves should be comfortable at the dentist. Because if the parents are not comfortable, it will be automatically transferred to the kids. That's the first thing. Second thing, we highly recommend never do treatment in the first visit of the dental visit, because the kids need to trust you. He needs to know that the first thing we always tell them, today we're going to just count your teeth, focus, brush your teeth, and go home.
That's really good. So, Dr. Mina, what are the most common procedures done in a child's teeth, and why it is so important to save the baby teeth?
Okay. Believe it or not, we do a lot of root canals these days for the baby kids, for the baby teeth, and parents, they say, root canal for a baby? Yes, we do, because it's totally different from adults. The procedures are totally different. We do cleaning, we do fissure sealants, we do fillings, extractions if needed. And why it's very important, because this teeth prepares the new teeth coming, the new permanent teeth to come. So if you don't save the baby teeth, there would be problems in the permanent teeth. Especially if you did extractions too early, you get something called space loss, and then you'll need to go for braces later. So prevention is better than cure again.
All right, Dr. Mina Charopeme, a pediatric dentist. Can you tell us, last question, some parents say that these are only like baby teeth. Just take them out. It's really simple. What do you think, doctor?
This is totally incorrect. As a pediatric dentist, we hate extractions, and we try our best not to do them. And when it's the last option, we have to tell them that it's not a pleasant experience. So please think about it again. And if we do, we have to place something called space maintainers.
Thank you very much, Dr. Mina Charopeme. And I'm sure, Doctor, that this is not going to be the last interview. I'm sure that I'm going to have you for much, much more upcoming interviews. And we're going to be talking about certain topics as well. It's an honor and privilege to meet you in person. You did a great job, seriously, Doctor.
Thank you, Saif. It's a pleasure to meet you, too.
Likewise. And I'll see you soon. That was Dr.
Inshallah.
Mina Charopeme, a pediatric dentist. And today we covered